thank you for joining us at the Firelands Diabetes Care Center. My name is Amanda Garman. I'm a registered dietitian at our care center. My job includes seeing patients in the outpatient setting. I see them for prediabetes, diabetes, heart disease, weight management, and other health conditions.
And my name is Brittany Frangella, and I'm a registered nurse, and I see inpatients and outpatient diabetic patients.
So today we are going to talk about prediabetes. Brittany, can you tell us a little bit about what prediabetes is?
Yes, prediabetes is when a person's blood sugar levels are higher than normal, but yet they're not high enough to be diagnosed as type 2 diabetes.
And what are some of the symptoms of prediabetes?
Typically with prediabetes, you don't necessarily have any symptoms. Usually it is diagnosed with 3 types of tests, which is the fasting glucose test, a glucose tolerance test, and then also a A1C test.
Is prediabetes common?
Usually it's estimated 1 out of 3 American adults have prediabetes, but most do not realize that they even are at risk.
Wow, so 1 in 3. So it's likely that we know somebody who has prediabetes, but that person may not even know it.
Correct.
What are some of the risk factors for prediabetes?
Some of the risk factors include being overweight. It could be not having any regular physical activity, increased blood pressure, increased cholesterol levels. Those are some of the factors that we can control.
So there, like Brittany said, there's some risk factors we cannot control, but others are in our control. So with the risk factors we can control, one of the biggest elements is our weight. It is recommended that we lose 5 to 7% of our body weight, and with that includes diet and exercise. The recommendation is that we exercise for 30 minutes at least 5 days a week. This can be any kind of movement. It can be walking in the park or walking on a treadmill. It might be doing a dance class or even playing with children at the playground. The goal is to move our body for 30 minutes, 5 days a week, more than what we would do in a daily routine. The other element that is important for weight loss is what we eat. As you can see on our screen, we have an image of a healthy eating plate. This is a good guideline to start you off. For most Americans, it includes increasing our fruits and our vegetables. As you can see on this plate, we also want to incorporate calorie-free beverages and more water, use healthy cooking oils, and lean proteins. If you'd like some help creating a customized nutrition plan and discuss more about this plate, please contact our office.
And then additional elements that go along with it is making sure that you go to your doctor's appointments routinely, take any medications daily, make sure that you get any lab testing done that your doctors may request. Making sure that'll also help you make sure that you are monitoring your blood pressure, your cholesterol, and then also your blood glucose levels. And then also make sure if your doctor would like you to check your blood glucose levels at home, they may give you a blood glucometer like this one. And if you're unsure kind of how to run the glucometer or how to do that at home, you can always give our office a call. We can kind of help you set that up and learn how to manage that at home.
So thank you for joining us today at the Diabetes Care Center. Our office is comprised of a physician, nurse practitioners, nurse educators, diabetes educators, registered dietitians, and pharmacists. We can help you in a variety of ways.
Yep, some of the additional benefits of continuing education is understanding about prediabetes, learning how to reverse prediabetes, improving your blood sugar control, nutrition, learning more about that and meal planning, decrease any complications that you may have that's gearing towards diabetes, and then also understanding any medications that you might be on. So thank you for watching.